here today in Cowal to meet with the co-chairs of the Cowal 24/7 implementation group. Heather Greer is a member of the public from St Catherine's and she co-chaired the group with Viv Hamilton, locality manager for Cowal.
7 years ago we had an out of hours review in my local practice at Stricker. And I became very interested in the process. There was a subgroup set up following that procedure and I was invited to join.
Well, I felt it was really important, having been through several service redesigns before and having involved members of the public in that process, that we did that in a more formal way for the 24/7. So particularly around the co-chair, I felt that was really important to have somebody else on the group who had that understanding and also who'd been through the process before several times. So had an understanding of the NHS, had an understanding of local authority and some of the processes and challenges that we were facing.
I did teaching for a wee while. I also went and worked for the dreaded HMRC for several years and set up a business consultancy after that. So I've always been involved in kind of processes and planning and things like that.
I've been involved with several reviews of services, probably actually going back about 15 years ago, before I was in this role. And I found that you get a really different experience when you have members of the public at the table. And I think that if you can build on that, I think the problem in the past has been that we've sort of dipped in and out of that public involvement. We've sort of done it when we had to. And it's been a process of consultation rather than actually engagement and involvement. And I think that what I've learned probably in the last 8 years in this job is that, you know, that doesn't really work.
I felt reasonably confident, basically because of the type of work that I've done in working in the private sector for many years. However, chairing a vast group of people, come different backgrounds, different ideas, different looking for different outcomes, was a bit of a challenge, I have to say, and it did take me a little bit of time to sort of settle into the role.
We looked for volunteers, I suppose, from the local community, from local community councils and Community Care Forum and the Public Partnership Forum. And when people expressed an interest, then the Cowal Community Care Forum in particular were really good at sort of talking that through with people to clarify what their interest was, what their expectations were of being involved in that group.
When we started, I felt there was a bit of antagonism towards some new ideas, and therefore I think I was persuasive to consider that and to get people to talk and to get people to voice their views and also to be receptive of other people's ideas.
The key for me is that we should not be paying so little attention to public involvement. I think it's to the detriment, actually, of integration if we do. I think having been through so much over the last 8 years and building up that sort of enthusiasm, if you like, particularly here in Cowal, for people are sort of queuing up to want to be involved. People are coming forward and saying, what's happening? Please tell me. We need to know so we can talk to our communities. And I think for us as an organisation, we have to listen and we have to provide something, some regular information to go out to the community as part of the learning from the 24/7 and from the other redesigns we've done. It's not about reinventing the wheel. All the good work is there, all the learning is there, and all the good practice is there. So we just need to find a way as an organisation of harnessing that and providing a framework around it so that we can help that to continue to move forward.
Yes, I always think, of course, there is. Nothing is ever perfect when one is going through any kind of process. Information about me at the beginning of the process to the group may actually have made them a little more confident about my ability. They knew nothing about me at the beginning. All they thought was, oh, here's a member of the public and she's been asked to co-chair this group. And I think there was a little bit of unhappiness about that. Regarding the actual process, I think some of the order wasn't quite right. Statistics and data, for example, came quite late in the process, and I think that should have been more upfront. And also the way the options were devised. The options to me were long, on the same theme, And I think there should have been much more thought put into a bigger diversity of ideas about what options we actually could bring here. I'm the co-chair of the Cowal 24/7 group.
You're sure not videoing this, are you?
If you put that bit in the end, that's...
We need a more salubrious background. This is just not good enough.
No, it's not.
I have completely lost my marbles.